After 6.5 years working with Dr. Miller, what can I tell you about Dr. Miller? Mostly that he really cares. He actually has even come in some nights, after some nights of not sleeping well, thinking about, the different options he has for a patient coming the next day, a difficult case. And that shows how much he cares, when he comes in and he's been thinking about all night long. He doesn't just walk out the door at the end of the day and go, oh, that's it, I'm done. He really thinks about it every minute of every day. And as far as working with him one-on-one, since I'm the only assistant, we do have a close working relationship. We're together, 8-9 hours a day. You've really got to like who you work with. It's really important. Part of the family environment allows us to be relaxed just because we enjoy each other's company. So we can joke around, we can include the patients with our jokes, and really it makes it kind of fun for everybody. Educating patients on the treatment that they have had recommended to them is really key in making sure that they make the best decision for them. When patients have to make a decision, it can be based on pure need, it can be based on pain, it can be based on their financial situation or their time situation. So when they know all the different aspects of the treatment, what are we going to do, how much time is it going to be, and what are my options, then the patient can really take it all in and decide which aspect of the treatment that's been recommended is best for them. It's not our place to make those recommendations on which choice they should make, because we don't live their life. But by educating them, they can make the best choice for themselves.